Come in. Hi, Christina. I'm Lauren. I'm going to be doing your cardiovascular assessment today.
Okay.
I'm going to first start by taking your vitals. I know we've already gotten your temperature, and it was 98.7, and your respiration rate was 16. So I'm just going to do your blood pressure. Okay?
Okay.
Is using your right arm fine?
Yes.
Okay. Sorry, it's a little cold. Alright, so I actually do a 2-step blood pressure, so it's just going to take me a little bit longer than normal. Okay, could you go ahead and flip your hand upside down?
Mm-hmm.
Perfect, thank you.
What was it?
The top number was just 110, so that means I'm just going to pump it up the second time to about between like 120, 130. It's just to make it more comfortable for you.
Okay.
Okay? Alright. Now I'm going to listen. All right, Christina, so next I'm just going to inspect you first, okay, to see if I see anything, all right?
Okay.
So I'm just going to be looking at the, sorry, my hands are a little cold. Just going to be looking at the temperature of your skin, noticing any edema. All right, edema is swelling, sorry, just so you know. All right, can I see your fingers real quick? I'm just going to check your capillary refill. All right, next one, thank you. All right, less than 3 seconds. Just a little range. All right, Christina, so next I'm going to be checking for jugular venous distension, and that's just to make sure that your heart is pumping your blood efficiently, okay?
Okay.
All right, so I'm just going to observe you right here. All right, and so since this bed doesn't move down, I'm just going to help you lean back because I do need to lean you at a 35 to 40 degree angle, so I'll have my hand behind your back, okay? So go ahead and lean back. All right, good. All right, and then go and sit up. And then if you can just lay down all the way. Okay. Great, thank you. And so while you're like this, I'm also just going to be checking for any pulsation, so if you could just stay still for me, okay?
Okay.
Here. I'm also just going to check your carotid pulses, okay? I'm going to palpate your chest wall. I'm going to be feeling for any thrills or heaves, and that's basically just like turbulent blood flow that I would feel with my hand, okay?
Okay.
All right, so at one point I will have to have you lift up your shirt a little so I can get better access, okay?
Okay.
Going to start at your angle of Louis, go to your second intercostal space, to the right sternal border, listening to your aortic valve, going to the opposite side and listen to the pulmonic valve. Alright, and then I'm going to go down to the fifth intercostal space, left sternal border, excuse me, and I'm feeling for the tricuspid valve, okay? I'm going to have to pull this down just a little. Alright, and if you could lift up your shirt a little bit for me, please. Alright, and now I'm going to go to your fifth intercostal space again and go to your mid-clavicular line, so right in the middle of your clavicle,
Okay.
and I'm going to be feeling for your mitral valve, okay? Yeah, you're good, thank you. Okay, great. And your chest does look symmetrical, okay?
Okay.
I'm going to listen to your pulmonic valve, so once again I'm going to start at your angle of Louis, go to your second intercostal space, and then I am going to be on your right sternal border for your pulmonic, okay?
Okay.
And it does have to be for 30 seconds each, so it's going to seem like it's a little bit long. All right, we're going to listen with the other side. I'm going to listen to your aortic valve. So on the opposite side, the second intercostal space, the left sternal border.
Okay.
All right, flip it over. Okay. Next, I'm going to listen to your tricuspid valve, so fifth intercostal space, left sternal border.
Okay.
So I will need you to just pull it down just a tiny bit for me. Thank you. All right, perfect. All right, you can go ahead and put your shirt back up. Alright, so I'm going to do the same thing, but I'm going to be listening to your mitral valve. So I will need you to lift up your shirt a little and try to move your breast tissue a little bit out of the way for me, because it usually is like right underneath, okay?
Okay. My left breast?
Yes.
Okay.
Pull it over to the side a little bit for me,
Okay.
okay? Perfect. Thank you. Okay, and while I'm here, I'm also just going to take your apical pulse, so I do have to do that for a full minute, okay?
Okay.
All right. Okay. And then put your shirt back down. All right, and next I'm going to be going diagonal to listen to one of the renal. All right, and then I'm going to go to the opposite side to listen to your other renal artery.
Okay.
Okay, next I'm going to listen to your iliac arteries, which I need to start at your umbilicus or your belly button, and I'm going to go diagonal from there, okay? All right, and then the opposite side. Okay. All right, so Christina, before I begin to check your pulses, at the same time, I am going to feel for your lymph nodes to see if there's any swelling or anything.
Okay.
So I'm just going to put on gloves, because when I go into your armpit, I'm going to use gloves, okay? If I can do your other side for me, please, too. Perfect.
Did I need to lift up this arm for the...
You can. I'll just
Okay.
just to make sure I didn't miss anything.
Okay.
I'm going to take out these off. All right, and so I'm just gonna, I have to do your pulses at your lower half too, so I'm just gonna start with your pulses up top.
Okay.
So I already did that carotid pulse first, so next I'm gonna be doing your brachial. So I do need to do both at the same time, so I'm gonna find one and then try to find the other on the opposite side, okay? All right. Next I'm gonna be doing your radial pulses. Okay. All right, so next I'm going to be listening and palpating, feeling for your femoral pulses, okay?
Okay.
So I'm going to start at your iliac crest. I'm going to go inwards, and I hope you're not too ticklish, because I do need to feel down for it.
I'm a little ticklish.
Hopefully you'll find it and you'll be okay. Okay, all right, and then I will need you to kind of lift up your shorts a little, because in order for me to listen to your femoral artery, I do need to be skin to skin.
Okay.
Okay, so just go ahead and lift. You can do one side at a time if you want, okay? So let me just make sure I can find it again. Okay, great. All right, you're going to put this side down. Do the same thing on this side. All right, go ahead and put your short. You can go ahead and bend your knees for me. Perfect. All right, I'm just going to feel for your nodes first. Okay, and let me see if I can find. These are kind of hard to find, so bear with me while I kind of try to.
Okay.
Okay, all right, you can go ahead and put your legs back down. All right, next I'm going to feel your dorsal pedal pulses.
Okay.
So the last pulse I'm going to feel for are your posterior tibial pulses. Okay. All right, Christina, now that we're done with your pulses, they are bilateral, symmetrical, and a 2+.
What does that mean?
They're not weak and they're not bounding. They're brisk, which is ideal.
Oh, okay.
All right, so I'm almost done with my assessment. I do have a couple special maneuvers I need to do first, but before I do that, I just want to check the capillary refill on your toes, okay?
Okay.
All right, so. And they are less than 3 seconds, so I'm just going to keep having you lay down and I'm going to perform a Homan's test. Sometimes this is used to help detect DVTs or deep vein thrombosis. All right, so go ahead and hold your knee up to your chest. Perfect. And I'm going to push and flex your foot. Do you feel any pain?
Nope.
No? Okay. To your other side. Okay, same thing. And bend your knee to your chest, flex your foot. Any pain?
Nope.
What I have to do is an Allen's test, which is for your hands or your upper extremities,
Okay.
and it's just to check for arterial insufficiency, okay?
Okay.
All right, so I'm going to do one hand at a time, so go ahead and give me your right hand, perfect. So I'm going to occlude your ulnar and radial arteries, and then I'm going to have you pump your hand at least 5 times until it becomes white, okay?
Okay.
All right, so go ahead and start pumping. All right, that's good. Okay, I'll let it. And then we're going to do it again. All right, that's good. All right, we'll do it to your other hand. All right, go ahead. All right, that's good. Okay. All right, sorry, am I like pushing really hard?
No.
Okay. All right, go ahead and do it again. All right, good. All right, and has anybody ever mentioned Raynaud's to you before?
Yeah, I've known about that for years.
All right, Christina, that concludes my cardiovascular and peripheral assessment. Do you have any questions for me?
I don't.
You don't? Okay, great. So prevention is the best method, so keep up that exercise routine you have and your healthy diet, okay?
I will.
All right, great. Have a great day.
You too.
All pulses, 2+, symmetrical, bilateral, no edema,